Now, you're watching Wave 3 News Listens Live.
And it is a celebration.
With your host, Jon Ramsey.
And welcome into the Wednesday edition of Wave 3 Listens Live. Okay, I don't know about you, but I don't think I've ever met anyone who is happy with their dentures, who says, I love my dentures. Do you have a loved one who says, I love my dentures, I wouldn't change, they're one of my favorite things? No, I'm betting that's not true. So this is why my next guest is so popular. Dr. Regan Ackerman is with us from Freedom Mini Dental Implants. Because let's go ahead and say it, Dr. Ackerman, I don't think there's anyone who really loves their dentures. And the good news is I think dentures eventually, thanks to you, will become something of the past.
Yes.
That's what I'm hoping for.
We're trying to get rid of the dentures.
Yes.
With the mini dental implants. You're able, to get rid of the denture, get a permanent bridge, cement your teeth in, have them in permanently, not have anything on the roof of your mouth anymore, be able to taste your food again, not have to use all the denture glue. There are so many ways we can use these mini dental implants, to get rid of the denture or keep your denture in better and, be able to get rid of that glue, for sure.
Yeah. Without mentioning any name brands, these glue companies, these grip companies, they probably don't like the way technology has helped what you can do, because before I think they had an advantage because it was so expensive to get the traditional surgical implants. It was so expensive and it was such a process and it took so long and there were surgeries and there was all this cost and different dentists and you had to have an oral surgeon and it was, wow, too much.
Yes.
So they had an advantage. But now it's so much easier and less expensive. They no longer have the upper hand.
Right. The mini implants have made implants, like you said, way more affordable for people that thought it was out of their budget or out of reach for them. Or, like you said, they thought they were going to have to go through months of surgery and healing or have to have bone grafts and sinus lifts. And with the mini implants, they're just a smaller diameter implant and a lot less invasive. So I don't have to do surgery, I don't have to do bone grafts, sinus lifts, and it's more affordable for people, that thought implants were out of their budget.
Yeah, and if you haven't heard about it, this is technology that's been around now for quite some time, but there are a lot of folks because they tried in the past and they didn't realize that, hey, technology has evolved, because you've had these implants now for what, 20 plus years?
Right, they've been around for 20 years, but like you said, technology has advanced. They've just gotten better and better. But it's, so it's not new technology. It's been around for 20 years, but, just trying to educate people and know that this option is out there. Because like you said, people have been wearing dentures, somebody's been wearing dentures for 10 years, and they're miserable at home, but they haven't been to a dentist, they don't know about mini implants, and they don't know this is an option. So that's where I asked them to come in for a free consultation at my office and see if they're a candidate, and we can probably help them out with the mini implants, and maybe they'll like their denture again where it stays in, or we get rid of the denture completely.
So if you have any questions, okay, so now you're hearing this and you go, this is new to me, and I was one of those folks who maybe went in to see a dentist before and they said you're not a candidate or it's going to be really expensive and here's your schedule, and you said I don't want any of that. 571-5263, 571-5263 if you have a question. Now, we're going to talk about this in detail today, but let's go ahead and proof's in the pudding. I always like these before and after pictures.
Yep.
So tell us a little bit about Mike.
So Mike was a patient. He came to me, needed teeth, knew he had to have teeth taken out. I had a lot of medical underlying issues, and that's another great thing about these mini implants. We don't have to take people off blood thinners. I see people, that are diabetic and with medical conditions that otherwise might not be candidates for the big surgical implants, but he was a candidate for the mini implants. So we were able to do the snap-in dentures for him, which I'll be able to, show a model later. But he's just smiling, he's got his teeth back, and now after I saw him, he was eating steak and just able to eat again and smile and have that confidence. And for him, a lot of it was the medical issues. He didn't think he was going to be a candidate or be able to do implants. And with the mini implants, we were able to, get him teeth that stay in with no glue and he can eat again.
You know what I love is, I love the emotional side of this, the way it changes people's lives. You mentioned foods they love and the confidence in their smile, but what I love is you can see that is a genuine smile on the right. And I'm happy for Mike, because I'm sure Mike is one of those, and you probably hear this story often, that you know, I'd given up. I wasn't a candidate, or I didn't have enough money, or I didn't want to go through all the surgery.
Yes.
You know, and so
every day I
yes.
hear that.
And so,
yes.
what was his reaction when he sees himself in the mirror now? He has to feel a lot better.
You know, more confidence, and he can go out to eat now and order, you know, anything he wants off the menu, and he doesn't have to avoid social situations. You know, like going, you know, family photos, things like that. I mean, so many people get embarrassed about their smile, or don't want to smile, or don't go to family functions. But, you know, with the mini implants, we can restore your smile, get you confident again, eating, you know, smiling, chewing, steak, carrots, all those good foods that everybody likes to eat.
If you're wondering if you're a candidate for Freedom Mini Dental Implants, then give us a call if you have a question, 571-5263. Before we start taking those calls, I think it's important to point out that a consultation is free.
Yes.
And also, I think it's important to point out that it is rare that you say no.
Right. It's pretty rare that I have to tell somebody they are not a candidate for the mini implants. Because like I said, the mini dental implants, they're just a smaller diameter implant. So I don't have to have as much bone. I just have to have some bone to work with. So especially people that were told they had to have major bone grafts or sinus lifts, they are usually a candidate for mini implants. But when they come in for the free consultation, I will take a 3D x-ray to confirm that they, you know, have enough bone, and go over their plan and give them, you know, cost. And it's pretty rare that I have to tell somebody they're not a candidate.
Yeah, and to be clear, if you were, maybe you checked out the standard, the old way, the surgical implants, and they said you don't have enough bone, and you're saying, okay, I'm excluded. This is different. You don't need much bone at all, right?
Right, yep. So, and actually, they're showing this x-ray, which shows the difference in the size. So this x-ray shows you the big screws, the big wide ones, are the surgical implants. So you can
that's the old way.
That's the old way. And then the mini implants are the smaller implants in this x-ray. So you can see how less invasive they are, and how I don't have to have as much bone and less healing time. And this patient actually came to me with those surgical implants and still didn't like her denture because it kind of moved around a little bit and wasn't happy. And so we went in and added, I added the mini dental implants and stabilized that denture even more. And now she just loves it, eats whatever she wants, is super happy. But I think this x-ray just shows them side by side. I know personally I would rather have the mini implant, a lot less invasive, less healing time, just easier all around, and more affordable than, you know, the big surgical implants.
Yeah, everyone has a budget. If you have a question, give us a call. So let's talk about the two different methods. You have two ways that you can help people.
Yes.
And both of them less expensive, less invasive. So let's take a look. So you have some models here, if you would, Doc?
Certainly. So kind of one of the most common things I do is what we call the snap-in denture. So what this is, you know, so imagine this is your mouth right here, and these are the mini dental implants. And when I place these implants, I am not making any incisions, no stitches. It is not major surgery. I'm just going to numb up the gum a little bit, place the implants, and the day I place the implants, you will leave with the denture. You see those attachments, and the denture will then be snapped on to those implants.
No glue.
No more denture glue, okay? And a lot of times, sometimes we can trim the roof out so you can taste your food a little bit. And you'll wear this denture 24/7. You'll sleep in it, but you'll just be able to snap it out and rinse and clean it whenever you need. But it just holds your denture in so much better. I mean, you've got that confidence and that security to know your denture is in, and you do not have to use gobs of denture glue anymore.
Yep.
So this is a fantastic option for people that are, you know, miserable wearing their denture, or having to carry around tubes of denture glue, you know, not eating what they want to eat because they're afraid their denture is going to flop out. So this is a great option, the snap-in denture.
Very secure. But now, I want to talk about the option that I love, and I think you've had a lot of success with. This is like your own teeth. This is, you're going to taste your food completely.
Yes.
There's nothing here but teeth, right?
Right. This is kind of the closest thing to getting your natural teeth back. We say this is like your third set of teeth. So same concept with the mini dental implants, you know, no incisions, no stitches. We're just going to place more implants, but then we're able to make just a bridge of teeth. And this will cement, kind of glue on to those implants, and then it is permanently cemented into your mouth. So it's just like having your teeth back.
So you just irrigate, you brush them?
Yep, you're going to brush them like you normally brush. We give you a water pick, a water flosser to keep them clean, but then you have absolutely nothing on the roof of your mouth, no plastic, no bulkiness of a denture. I mean, this is like your third set of teeth, and this is definitely the nicest thing we do for patients, and patients love this option. But once again, with the mini implants, it's just a lot less invasive, less healing, and it's a lot more affordable than, you know, trying to do this permanent teeth with the surgical implants.
And there's lots of options. Perhaps you're saying, well, I have a bridge, I don't need a full set of dentures. You can take care of that. A single tooth, you can do all of that.
Yes, yeah, I can show that model as well. So yeah, we can do just one tooth. You know, a lot of people maybe had trauma, bad accident, they lost a tooth in the front. You know, we place the mini implant and then we cement the tooth, the permanent crown, onto that implant. A lot of people have what they call flipper or partial, and they can get rid of that with the implant. Same thing, you know, if you're missing 2 or 3 teeth. A lot of people are missing their molars in the back, what I call your big chewers. And it's hard trying to chew steak and what you want when you're missing your back teeth. So with the mini implants, we can do just, you know, 2 or 3 teeth and get rid of that partial. So it's a great option.
Wow. Yeah. Freedom Mini Dental Implants. And again, I cannot stress it enough. The consultation is absolutely free. Dr. Regan Ackerman. If you have a question, 571-5263. Let's see if you're a candidate, man. I'm telling you what, you're going to love it. You'll love your new smile. The foods that you love, they're back on the menu. We'll be right back on Wave 3 Listens Live.
Get your ticket to ride. It's the Wave 3 News Abbey Road on the River, May 21 through 25 at the beautiful Big 4 Station Park in Jeffersonville. Over 50 bands and 200 concerts in one Beatles-inspired weekend. Starring Tommy James and the Shondells, Little River Band, The Circle, and Wings lead guitarist Lawrence Juber. Tickets just $25 with promo code WAVE3NEWS. Buy them now and get a free ticket for a 21 and under guest.
A message from attorney Mike Sullivan about disability benefits.
You can't work anymore, you file for disability, and they shut the door in your face. Don't let Social Security deny your future. You paid into this system. Now it's their turn to pay you. Fight back. Let me open that door for you. Call me now. Come on in. We got it.
Call 888-587-0228. Call now.
So now that you've seen and heard about the advantages of Freedom Mini Dental Implants, you're saying, am I a candidate? Bet you are. 571-5263. We'll field some calls here. First, let's talk to Angel, who's been nice enough to join us and call. Angel, welcome in. You have a question for Dr. Ackerman?
Yes, hon, I do. Honey, when I had my dentures made, I have a top plate, and then I have a bottom on the left side partial. But I have a real bad gag reflex, so they had to keep cutting them down. If I was a candidate for your snap-on, would they still gag me? I guess is what I'm trying to ask.
Yes. No, I'm so glad you called in, because you are not alone in this gagging. So many people cannot tolerate that denture all the way back. And then you're right, the only solution is to trim it back, but then you lose suction and the denture won't stay in. So yes, definitely if you're a candidate for the implants, and then when we put the implants in, we'll trim, you know, the denture back to where,
you don't need the suction.
Yeah, we don't have to have the suction because the implants are going to keep it in. And then you know, don't have to worry about gagging anymore. So people like you, I help out all the time that are gaggers. You know, of course, the permanent teeth is ideal. You get rid of all gagging, but if you can't do that, then yes, definitely with the snap-in denture, majority of the time we can trim it back so you're not gagging, and then the implants are keeping the denture in, and you don't have to rely on suction to keep the denture in. You are not alone in that. So many people struggle with that, and we're able to help them. So thank you for calling.
Thank you for the call, Angel. Yeah, so much to love about dentures. You know, the taste of that glue. Delicious, right? Oh, it's delicious. The gagging. You know, who doesn't love that? Yeah. I mean, all of it is just like, I can't imagine, and it's good. Now, technology has moved on. As you said, even the mini dental implants have improved. People ask all the time, are they as durable as the old surgical way? Yes.
They are. And, you know, every day I see patients, you know, because Dr. Stroud was there before me doing them for 10 years, and I see patients every day that have had their mini dental implants in for 15 plus years, and they're still in there solid. So they work. They are durable and work just as well as the surgical implants. They're still made out of titanium, the same material, so they do work. Oh.
Yep. If you have a question, 571-5263, and we get a lot of questions, and this happens often, and you've never run from the cost issue because we say they are less expensive, and they are. So obviously without a consultation, it's hard to tell the exact price.
Right.
But if you had to compare it to the old method, what are we looking at here?
I mean, it's at least a third to half the cost of the surgical method.
Ooh, that's significant.
You know, it's pretty standard, a single tooth. You know, you're missing one tooth. For a surgical implant, besides having to go, you know, an oral surgeon and back to your dentist and like a year-long process, I mean, that can be anywhere from $4,000 to $5,000 for a tooth. The mini implant, it's about half the cost of that for a single tooth. So it's definitely, you know, more affordable for people with the mini implants to be able to replace a tooth.
And you have payment plans too.
We do have payment plans.
Good.
Yes,
That's
definitely
good,
payment plans. You know, that's part of the free consultation. We can go over that with you and help you apply. Some of them can go up to 2 years with no interest. So it's very helpful to have the payment plans.
We had a question, folks. Sometimes you get a little shy, we understand, but the question was about a warranty. They said, do you offer a warranty on the Freedom Mini Dental?
So we do. There is a 5-year warranty. You know, dentures can break or tooth, you know, everyone's different, wear and tear. I kind of relate it to cars. Some people are harder driving their cars than other people. But for the first 5 years, if, you know, your denture cracks or breaks, we'll, you know, repair it at no charge. Same thing with the implants. So there is a warranty on it for sure, because we want you to be happy and we want things to work for you, and we want to honor what we do.
Everyone's different, so like if you're flossing with barbed wire, probably, you know.
Yeah, there are limitations to things. So I always say, you know, chewing ice and, you know, biting into apples, that's always the biggest thing.
I love my almonds.
Almonds. I mean, that can break a regular tooth. So,
well, you talk about, you know, one of those things that just to me is nails on a chalkboard. People who crunch ice, don't get me wrong, God love you if you can do that, but how do you react to that?
It makes me cringe as a dentist, for sure. It is the #1 thing I always tell people, please just don't chew ice. I don't chew ice with my regular teeth. I mean, that is a hard thing. You know, it can break a regular tooth, much less an implant or a crown.
Something I wanted to ask you. We've got a little bit of a lull. If you have a phone call, now's the time to call, 571-5263 with your question. But, okay, let's go ahead and talk about something that everyone's talking about. The coronavirus. Right now, is it a bad time to see someone like yourself, a dentist, someone that's, you know, obviously there's some germs involved, but I would think you have a sterile environment. So
practicing the same protocol, sterilization, you know, we have, you know, very clean. So, you know, it is okay still to come to the dentist or to, you know, have implants placed. Obviously, if you're sick, we don't want to see you. You need to stay home. But, you know, our sterilization protocol is still the same and everything is clean. So it's not a reason not to come in for the, you know, a consultation or go to your regular dentist. I think a caller on a previous show had asked that question. So, yeah, it's all out there right now.
Yeah, nothing has changed in your office. It's always been sterile. It's always been job one, priority one.
Always protected against all the viruses.
So there you have it. All right, we got that out of the way. 571-5263. We'll take a quick break. We'll come back. Your phone calls are welcome. Again, Freedom Mini Dental Implants on Wave 3 Listens Live.
I'm Kent Taylor. And I'm Kendrick Haskins with Wave 3 News.
Join us Wednesdays at 6:30 p.m. We will go in-depth on current sports topics,
highlight upcoming games, and interview local sports stars.
Sports Talk, sponsored by Bearno's Pizza. Stream it live.
I'm John Morgan. If you've been injured in a car accident, call Pound Law from your cell phone. Morgan & Morgan. Pound Law, that's all.
Watch Family Feud, weekdays at 4 on Wave 3 News.
Oh, it's fun, it's sporty, great fuel economy. Tim Jones back for Toyota of Louisville. It's the Get Ready, Get Set, Let's Go sale. and we've got a great selection, friendly salespeople. It's hassle-free shopping. Right now, on a brand new Corolla, you can get a 36-month lease with a payment of only $169 a month. Got a trade? We want your trade-in. Easy to get to 7 days a week on Dixie Highway, or log on to toyotaoflouisville.com, a Swope dealership where nobody walks away.
Freedom Mini Dental Implants. Welcome back to Wave 3 Listens Live. This is Dr. Regan Ackerman, and we were talking about the need for bone with these implants and with the standard surgical, the old procedure. That was a need, but this is different, and we wanted to kind of, I guess, illustrate how little bone you really need to make this happen, because if you've had periodontal disease, you're losing bone.
Right.
But you're saying this is different. You don't need a lot.
As much bone. And that's a good point. A lot of people were told they had periodontal disease and bone loss, and they don't think they're a candidate for implants. So this model shows exactly the difference between, you know, the bigger implants, that's
what they
the
needed
big
before.
hole. That's the old way. Now this little hole, which is hard to see, that's the hole I make when I place an implant. So you can see that I don't have to have as much bone. I just need some bone to place a mini dental implant. So that's why I don't have to do bone grafts or sinus lifts, and why a majority of people are candidates for the mini implants, this little small hole, you know, versus the big hole. And also it's just, you know, a lot less invasive and a lot less healing time, you know, versus the surgical implant, which, you know, has to heal up a lot longer, a little bit more of a surgery and more involved. So this is a great kind of illustration, like you said, of the difference between the two.
Yeah, that big hole there, that looks like something I got out of my, a drill I got out of my garage. Yeah, that drill out of my garage. I said, oh, just open up, let me have at it. Okay, and this is, again, another illustration of, look at the small little titanium implants that you use compared to the old way.
Yes, so you can see, you know, how much bigger and wider the surgical implants are, and, you know, that can be up to a year, year and a half long process versus, you know, the mini implants, a lot less invasive, you know, just, and I don't have to have as much bone, so more people are candidates for the mini implants.
I wish we had a, you know, like a yearbook, so to speak, of all the people, the before and after pictures.
We should put together a book.
you always bring one in, a different one every week, and I love it because whenever you come in, because they just, you can see the difference in the smile, the confidence level, you know, and now they can look forward to eating foods they love.
Oh, it's life-changing.
Yes.
It really is.
I mean, look at Mike, my man.
It's so fun to hear people's stories of, you know, what they do now, and you know, I had a patient, he came in for his post-op check. We had placed his implants a week ago, and he's like, oh, I had the best ribeye steak. And I was like, great, that's awesome. So,
well, that's what you want to hear.
Yeah.
It is fabulous. I think, for me, I can relate to this because we've all seen it happen. Everyone's getting ready for the picture, the big family picture, weddings or whatever, and you have someone there who wears dentures who passes. Yeah, no, I'm not going to do that, because they're just not comfortable with their smile.
Right. And you may not know, because so many family members, they suffer in silence because they're embarrassed and they don't want to tell anybody. So, you know, if you're out there suffering and, you know, you don't want to tell anybody, just call for the free consultation, and I'd love to see how we can help you out so you can have that confidence and that smile and go to those family functions and eat what you want to eat. You know, don't suffer in silence anymore, because it's worth it to come and see if we can help you out.
Yeah. Everyone deserves to have a smile they feel confident about. Let's go back to the phones and chat with Edward. Edward has a question for us. Edward, thanks for watching. Welcome in. You have a question for Dr. Ackerman.
Yes, I was just wondering if she could put my partial plates onto something to hold them secure.
So a lot of times we get rid of the partial plate. Instead of, you know, trying to snap in the partial plate, we'll, you know, replace those teeth with like a bridge and do the implant. So I can definitely even go one step better and get rid of that partial for you completely and replace those teeth with the mini dental implants. That's the best way to do it. And we do that all the time, you know, if you're just missing 2 or 3 teeth here and there, and getting rid of that partial, because nobody likes wearing the partial. It's bulky, it moves around, and when we do the mini dental implants and place, you know, a bridge or a crown over it, it feels like your natural teeth, like you got your teeth back. So
let's talk a little bit about age demographics. By the way, thank you for the call, 571-5263 if you have a question. But age demographics, because sometimes I think people think, oh, this is for the elderly, but maybe you have a genetic problem with your teeth.
Yep.
Maybe you've lost a tooth in a sporting accident, male or female. I mean, you can help them.
I've placed implants on an 18-year-old and up to a 96-year-old. I've placed implants a couple weeks on a 96-year-old that he was tired of his denture, wanted be done with his denture. But you're right, so many young people, some are born without permanent teeth, especially those front teeth on the side, your laterals. A lot of people are genetically born without those. And when you're in high school and college, you don't want to have to be wearing what they call a flipper or a retainer with teeth on them and have your teeth coming in and out. So we're able to do the mini implants for young people as well and get rid of whatever retainer or flipper they may be wearing to try to replace those teeth. I've seen so many people in their 20s and 30s, they've been wearing this flipper for 10 years, and then we replace their tooth with an implant. Actually just cemented a crown on this morning for a lady in that exact situation, her front tooth, and she was like, I'm finally getting my tooth, and it was great. So yeah, and age is not a limit. 18 to 96-year-olds, we've seen them all.
I bet the dramatic difference, because I have a cap tooth here up front from a sporting accident, and bottom line is when it's been replaced before and they take it out and they show you in the mirror, it's scary.
Yeah.
It was like, whoa, okay, put that back on quickly if you would, please.
Yeah.
It's really to where you'll have nightmares.
Yeah, it's the first thing people see is your smile. So it definitely, smile is everything and gives you the confidence to do what you want to do. So we're here to help and restore your smile again and get you chewing and eating the healthy foods you want. I mean, that's another big thing. It's not, we talk about smile and aesthetics, but a lot of it is function. Being able to eat those fibrous and healthy foods and, carrots and steak and salads. If you're missing teeth or you have dentures that don't stay in well, you cannot eat those healthy foods, and it affects your overall health.
Yeah, I would think all those foods that you mentioned are nutritionally dense. If you're missing those from your diet, then your health's going in the wrong direction as well. One more question. I always have fun asking you about this one. So you give them a choice on what color teeth they would like. You can have something a little bit more natural, a little off-white. What do they choose?
A majority I want them as white as possible, bright white. So, because so many people have waited so many years to get their smile back, and they want them, white.
Neon white.
Neon white. So, but no, we do have a lot of natural smiles, but we work together, and I show people shades, and it's ultimately what you want. Some people do go for the more natural, and then you do have people that want the bright white, and that's up to them. It's their mouth, and it's their decision.
Yep, we've come full circle, so it's your decision. Let's throw away the dentures with Freedom Mini Dental Implants. We're going to take a break, and we'll be back on Wave 3 Listens Live.
I was 13 years old, and I knew exactly what I wanted to do with my life. I sat at this table, and I wrote a letter to my senator telling him I wanted to fly fighter jets in combat, and that women should be able to do that. He never wrote back. I'm Amy McGrath. Eventually, I did get to fly 89 combat missions for our country. But it turns out there have been many other Kentuckians Mitch McConnell ignored. A disabled teacher desperate to keep her health insurance. A World War II veteran who was dying and needed in-home care from the VA. A group of retired coal miners with black lung disease who traveled 10 hours on a bus and only got 1 minute of Senator McConnell's time. Mitch McConnell ignored all of them, and so many more. You'll be hearing their stories in the weeks ahead. I approve this message because what good is a powerful senator if he treats Kentuckians like this?
So no more procrastinating. Dr. Ackerman, free consultation.
Free consultation. All they need to do is call, come in, free 3D x-ray, free consultation to see if they're a candidate.
There you go. Give them a call today. Freedom Mini Dental Implants. Have a great day, and then we'll see you tomorrow for the Thursday edition of Wave 3 Listens Live. Have a good one.